Hello friends, let us now learn about the 10 steps of successful breastfeeding. 10 steps of successful breastfeeding are given under Baby Friendly Hospital Initiative 1991 WHO UNICEF. So according to Baby Friendly Hospital Initiative 1991 WHO UNICEF, there should be a written breastfeeding policy for all the mothers. We should train all healthcare staff in skills of breastfeeding. Inform all pregnant women about the benefits of breastfeeding and why she should breastfeed her infant. Help the mother to initiate breastfeeding within half an hour of birth, because this will help the mothers this will release oxytocin and help in contraction of uterus and to decrease the postpartum hemorrhage. Then show the mothers how to breastfeed and how to maintain lactation even if they are separated from the infant. This will enhance their confidence in breastfeeding. Then give the newborn infant only breast milk, no food, no drink. You should not even give water to the newborn. They should always be given breast milk. Practice rooming in. Rooming in is allowing mothers and infants to remain together for 24 hours a day. This will help to increase the bonding between mother and child. Encourage breastfeeding on demand. Foster establishment of breastfeeding supporting groups and refer them to mother on discharge. We should establish breastfeeding supporting groups and refer them to mother on discharge. Then eliminate any support by manufacturers of infant formula feed. Never give any infant formula feed to a baby. So these are the 10 steps of successful breastfeeding which are important. Prohibit distribution of free and lost cost supplies of breast milk sample also. And then we should assure a safe, healthy, positive birthing experience for the mother and infant. So this is about the steps of successful breastfeeding. Thank you for watching my lecture. Thank you.